Peace be with you. I'm making this video to talk about the COVID vaccine because it has been recently introduced in the childhood immunization schedule here in the United States. And the reason why I'm making this video is because I can't understand why they would make this recommendation. So I'm just gonna lay out some facts here and talk about them a little bit. Now, most of the time I make videos about religion and about Islam and what the Quran says, but I'm also an emergency room doctor and this is my field of expertise. I am only speaking for myself. None of the institutions I work for have anything to do with what I'm saying here, so this is my personal opinion. So the childhood immunization schedule has been updated to include primary series for COVID from the ages of 6 months to 4 years of age, and this is a 2-dose series, 2 or 3 dose series, depending on whether you are using Pfizer or Moderna vaccine. Then from age to 5 and 11, you also have 2 or 3 dose series, depending on whether you're using Pfizer or Moderna. And then from age of 12 to 18, also another series. So that is the CDC immunization recommendations now. Now, these are not mandatory, but whenever CDC makes recommendations like this, you can count on some municipalities or localities making these mandatory for school attendance, especially during the cases of outbreak. So why have these vaccines been included for children? You know, is COVID very, very dangerous to kids? And the answer is no, it's not. From the beginning of the pandemic, from the year 2020 to now, 2023, all deaths involved with COVID-19 in the age group of 0 to 17 years, we have 1,495 deaths. That is total deaths for this age group. And this is, although every death is tragic, this is exceedingly low number given what we have seen in the older age groups. For example, in the 85 or older, we have seen almost 300,000 COVID deaths. So this is a virus that predominantly kills the elderly. And even most of the kids, a lot of the kids, I'm not going to say most, but a lot of kids that died from COVID, they had some sort of a pre-existing condition. So that's not the only thing I wanted to mention. Another thing that I found very fascinating is if you look at the research for the length of effectiveness of the COVID vaccine, there's an article in the Lancet and there's an article in the New England Journal of Medicine, and most of studies, or the Lancet study was a systemic review of articles or research studies. And most are estimating the length of efficacy between 6 months to a year. So that doesn't really make sense when you look at the immunization schedule proposed by the CDC or promoted by the CDC, you know, where you have, okay, so you give a series from 6 months to 4 years. You give one series, and then what happens, you give another series from 5 years to 11 years. That's a 6-year span there, and you just give one series of a vaccine that has estimated efficacy of approximately 6 months to a year. So it doesn't really seem purposeful. It just seems to be doing something for just to say you've done something. And that's the problem I have with this. We have an age group that is extremely unlikely to get very sick from COVID or die from COVID. We are including a vaccine that is only 2 years old into a vaccine schedule. And if you look at the history of drug evaluation, sometimes drugs are not even known to cause severe side effects up to 5 years until they're introduced in the general population. So they are rushing this vaccine for no reason, because these kids are not it's not that dangerous to kids. Although, like I said, every death is tragic. It is not terribly COVID is not terribly deadly when this particular age group is concerned. And there's a lot of concern for side effects in these vaccines already. So there's really no need to introduce the vaccine into the vaccine schedule now. And also the way it's introduced, it really doesn't make any sense, because you're just, immunizing these children for a year, then you give them like 4 years where they're not immunized, then you immunize them again, and their immune response will last for about a year, then they have another 4 years. So it really doesn't make sense. I really don't know why the CDC is doing this, but it just doesn't feel that it is grounded in science, and that's why I made this video. Peace be with you.